Hello everyone, my name is Novina Rao. I'm working as a professor at Sri Shanmuga College of Nursing for Women. I would like to explain to you in this video about the disease myocardial infarction. Coming to the introduction, myocardial infarction is also known as heart attack, which most of us must have heard this, right? So what happens in this disease is there is blockage of oxygenated blood to the heart muscles. It is considered a very life-threatening situation because the oxygen supply to the heart is completely blocked, leading to death of the heart muscle tissue. And talking about the term myocardial infarction, myo refers to muscle, cardia means heart. So the myocardium means the heart muscle. Infarction means the death of the tissue. So here there is blockage in the coronary arteries which is caused by clot, and it is also because of fatty deposits called as atheroma, and that leads to atherosclerosis, narrowing of the artery. So when the oxygen supply to the heart muscle is disturbed due to blockage in the coronary artery, the heart tissue begins to die. And heart disease in particular is one of the leading cause of death rate worldwide. And as nurses, it's very important for us to understand the disease condition in detail. Like coming to the definition, myocardial infarction is a irreversible death of a portion of a heart muscle due to prolonged interruption of blood supply to the coronary arteries. And if you can see in this picture, there is if you take the first picture, in this area there is a presence of the blockage. So how it is blocked? Due to the presence of plaque or the fatty deposits. And what happens is the plaque grows, it ruptures the inner lining of the artery, leading to bleeding, and platelets get aggregated, leading to formation of clots, and that will completely block the blood vessels, and the blood supply is hindered to the heart muscle. So this is the reason for myocardial infarction or the heart attack. Next, anatomy review. All of us know heart is a hollow muscular organ which is located in between the lungs, that is the mediastinum. Weight is about 250 to 350 grams in adults. It has four chambers, right and left atrium, right and the left ventricle. And if you take the layers of the heart, we have the innermost layer is the endocardium, the major important layer, the thickest layer is the myocardium, then the outer covering epicardium, and the outermost is called as the pericardium, which is made of again two layers. And coming to the coronary arteries, which supplies the heart muscle with the oxygenated blood, we have the right coronary artery and the left coronary artery. The left coronary artery is again branched into the left circumflex artery and the left anterior descending artery. And the major function of the heart is pulmonary circulation and the systemic circulation. And the cardiac cycle, we have two phases, systolic and the diastolic. Systolic means the heart contraction, diastolic is the ventricular relaxation. So all these things are required in order to for the heart to do its function properly. Coming to types of MI, based on the ECG reading, we have STEMI and NSTEMI. STEMI is XT segment elevation myocardial infarction, where in the ECG recording there will be elevation of the ST segment which resembles complete blockage, whereas in NSTEMI there is no ST segment elevation, and it's the blockage is partial. In STEMI, the blockage is complete. In NSTEMI, the blockage is partial. And based on location, also MI is classified like where the blockage is present. Based on that, it is classified as anterior wall MI, inferior wall MI, and lateral wall MI. Coming to causes, blockage of the coronary arteries due to plaque formation, atherosclerosis, blood clots, coronary artery spasm, severe anemia. Risk factors, first one is non-modifiable, the risk that cannot be changed, which includes age above 45 years in men and above 55 years in women. Then we have family history of heart disease, and then comparing to male and female, males are at more risk compared to females. Then coming to the modifiable risk factors, that which can be prevented and changed, it includes hypertension, diabetes mellitus, smoking, obesity, high cholesterol, sedentary lifestyle, and stress. And coming to the pathophysiology, it starts with formation of atherosclerosis, and as it grows, the inner lining of the artery breaks, and leading to formation of blood clots as the platelet gathers at the rupture site. So what happens is it leads to blockage of the coronary artery, and it leads to decreased blood supply, and ends with myocardial necrosis. Signs and symptoms includes patient will experience severe chest pain which is prolonged more than 20 minutes. Pain can radiate to the left arm, shoulder, neck, jaw, or the back. Patient can have breathing difficulty, cold, sweating, which is known as diaphoresis. Can also experience nausea, vomiting, palpitation, where the patient will be able to feel their own heartbeat even at rest. The pulse will be weak. Patient's blood pressure will either be high or low, and patient will have symptoms of dizziness or syncope. What are the diagnostic investigation? The basic thing is ECG, where doctors check for the ST segment changes, and cardiac enzyme tests like cardiac troponin, CKMB to confirm the MI. Then basic scanning called as echocardiography, where the wall motion and the cardiac function is assessed. We have coronary angiography, where the site is identified, and the blocked area is compressed, or uh, they check where the blockage is exactly present, so that treatment is given accordingly. Then chest x-ray, which can detect cardiac enlargement and also pulmonary complications. Coming to medical management, basic is oxygen therapy, which will improve the blood supply to the ischemic myocardium. We have anticoagulants like aspirin, which is given to prevent the formation of blood clots. Even antiplatelets have the same function. Example is clopidogrel. Nitroglycerin, it opens up the artery. It's a vasodilator, and when more oxygen flows to the heart muscle, the chest pain is relieved. To treat chest pain, morphine is given. It can also reduce anxiety, and in severe cases, if doctor mm, feels that it is important to melt the clots, for whom stent placement is not possible, then they go for thrombolytic therapy using streptokinase or TPA, tissue plasminogen activator. In order to maintain blood pressure, beta blockers and AC inhibitors can be prescribed. Then coming to surgical management, we have PCI, that is percutaneous coronary intervention, also called as angioplasty, where a small surgery or a small procedure is done to open the blocked coronary artery using balloon and stent. Then we have the open heart surgery called as coronary artery bypass grafting, which creates a different pathway so that the blocked artery is bypassed and the heart muscle receives oxygenated blood. We have a stent placement as a part of angioplasty, and thrombectomy, where surgery is done to remove the clot from the coronary artery. We have ICD, implantable cardioverter defibrillator, and this treatment prevents sudden cardiac death due to arrhythmias, because the cardioverter defibrillator is implanted into the heart. So whenever it detects that there is risk of heart attack, it stimulates the heart to pump. Then the next one is pacemaker insertion, where when patient is having a decreased heart rate, it detects and it again stimulates the heart to pump, which can also reduce the risk of MI. So this is a picture of balloon angioplasty, where through the one a major vein it enters the heart, major artery it enters the heart, and then as it reaches, the catheter is fitted with a camera. So when it reaches this place, the area of blockage, the balloon is inflated, and in severe cases, a stent is placed. Then this is a coronary artery bypass surgery. So this is the area of the blockage. So they take one of the blood vessel from other parts of the body and they fix it, they graft it. They attach it so that this blood vessel bypasses the blocked region and the heart muscle receives oxygen. Next, coming to nursing management, as nurses, we have to check patients' chest pain. Vital signs need to be checked regularly. So based on the treatment is planned and based on the SpO2 level, oxygen should be administered as prescribed by the doctor, and also medications as ordered. The dosage, route, and frequency properly should be given, and the continuous ECG monitoring to detect any type of abnormal heart rhythm. Advise the patient to maintain bed rest and reduce anxiety and stress levels. And lifestyle modification is one of the major things that we have to insist on and educate the patient so that complications are prevented. Complications includes arrhythmias, cardiogenic shock, heart failure, pulmonary edema, myocardial rupture, and reinfarction. Arrhythmias, irregular heart rhythm. Cardiogenic shock, severe pump failure leading to low BP. Heart fails to function. Pulmonary edema, fluid accumulation in the lungs due to failure of the left ventricle. Myocardial rupture, tear in the heart wall, causing cardiac tamponade reinfarction, reoccurrence of the MI. Prevention is advise or educate patient to stop smoking, follow a healthy diet pattern, low fat and low salt diet, regular physical exercises improves heart health. Controlling BP and sugar is very important to prevent complications, maintaining healthy body weight so that the workload of the heart is reduced, and go for regular health checkups. Role of nurses, health education, screening, promoting medication adherence, encouraging to go for regular health checkups so that it's identified early and treated early, and the prognosis is good, and how to control stress management and continuing campaigns, community awareness programs. So prognosis depends on early treatment and good lifestyle modification. If it's not done, then the prognosis is poor. So coming to the conclusion, MI is a life-threatening situation which is caused due to blockage in the coronary blood flow, which damages the myocardium. Early treatment, effective nursing care, and lifestyle modification helps in reducing the mortality and complications. So, patient education and preventive measures are very important to improve the prognosis and quality of life. Thank you all. See you in the next video.